All right. Well, we literally have a lot to do this evening, so let's get started. Welcome, everybody. We are so glad that you're with us tonight for this very important presentation, Children and COVID Vaccines, Healthcare Experts Answer Your Questions. My name is Charlene Margot, and I'm the founder of the Parent Education Series and co-founder of nonprofit, The Parent Venture. We are so delighted to be here tonight, helping to produce this event with some experts from the Stanford medical community. Again, if you need Spanish interpretation tonight, we have with us interpreter Luis Romero. There is instructions in the chat for how to access the Spanish. If you go to the globe icon at the bottom of your screen and click on Spanish, you will hear a Spanish interpretation. Again, special thanks tonight to our host, Peninsula Healthcare District and Executive Director Cheryl Fama and Outreach Coordinator Ann Wasson. We are also very grateful to our panelists tonight, Superintendent Nancy McGee, Dr. Roshni Matthew, Dr. Hayden Schwenk, and Dr. Ryan Padres, who we hope will be with us momentarily. Before we go any farther, I would like to introduce you to Dr. Lawrence Capel, who is the board chair at Peninsula Healthcare District. Dr. Lawrence, again, has served on the board at Peninsula Healthcare District since 2009. He is currently the chair and chair of the district strategic direction committee. Lawrence, please take it away for a few comments.
Thank you so much. Good evening to everyone, and thank you so much for your interest in this very important topic. My name is Larry Capel, and I serve as the board chair of the Peninsula Healthcare District. The Peninsula Healthcare District's vision is that all of our residents achieve their optimal health through prevention, education, and access to medical, dental, and mental health care services. This evening's program is an example of the district's long-standing track record of providing educational opportunities to contribute to each individual's health literacy that will help them make informed health decisions to prevent illness and promote their health and that of their family members. Tonight, we're here because you have questions, a lot of questions, and so do we. And so we thought it best if we could organize a program that consists of the very best medical professionals in the area. And I believe we have that this evening. This is your opportunity to ask anything that concerns you or that you're thinking about. We want you to leave tonight better informed and hopefully with the confidence to vaccinate your children. Together, we can beat this pandemic. I know we can, and I think together we will. With that, I would like to introduce you to Nancy McGee. Nancy is the superintendent of schools for the San Mateo County Office of Education. Nancy is on the panel for a very important reason. We wanted to make sure that we had someone in a powerful position to be able to respond as a panel member from the perspective of the schools and children and the relationship to COVID vaccines. Welcome, Nancy.
Thank you, Larry. So is this my time to say a few words? It's so great to see everybody here. I'm honored to be part of this esteemed panel. You know, our focus is on educating children well, both with high quality, engaging instruction and providing all the social, emotional, and mental health supports that they need to be successful in whatever grade and space they're in, but also long-term in life. So the COVID-19 pandemic has really presented so many challenges to operating schools in the ways in which we're typically used to. So you all know and experienced a year plus of distance learning. And we know that really children learn best in person together in space with their teachers and the support of adults around them. So this year we've been fortunate in San Mateo County to have all of our schools open, all of our students attending in person, and we're working with our health partners at all grade levels, not only to ensure that as many of our children and staff members are fully vaccinated, but also following all of the COVID-19 protocols that have helped us keep kids coming back to school every day without serious transmission. And so it's a pleasure to be here with everybody. I look forward to the conversation. Thank you for having me.
Thank you so much, Nancy, for that really nice introduction. If you're just joining us, Nancy McGee is the superintendent of schools for the San Mateo County Office of Education. She is part of tonight's very distinguished panel. Also, we want to welcome Dr. Ryan Pedrez, who just joined us. Ryan, thank you so much. Glad you could make it. If you don't mind, on the bottom of your screen, Dr. Pedrez, if you click on the globe icon in English, we would be able to hear you better. So just a few housekeeping details before we get started. Tonight is a webinar format, so you, the audience, can engage with us in two ways. First of all, there's a chat button, and my co-founder, Bev Hartman, will be putting resource links into there. Please feel free to talk to each other, talk to us, talk to everyone using the chat function, but we would like you to put your questions in the Q&A button. So again, questions in the Q&A, try to keep them brief if you can, and comments and resources in the chat. We look forward to your conversation. Please do feel free to share with one another. Also, this video is being recorded tonight and will be available soon on our video library. Bev will also drop a link to the video library on YouTube into the chat. We've had over 30,000 views on that library, so this video will be there in a few days. We partner with the team from Boys and Girls Club of the Peninsula for our videography. Always an honor to have them. It does take them a few days. So let me tell you a little bit about tonight's distinguished panelists. First of all, Dr. Roshni Matthew is a clinical associate professor in the Department of Pediatrics and Division of Pediatric Infectious Diseases at Stanford University School of Medicine. She also serves as the co-clinical chief for the Division of Infectious Diseases. She is the co-medical director for infection prevention and control at Lucile Packard Children's Hospital, and she was part of the leadership team that led the institutional response during the COVID-19 pandemic. Next, we have with us Dr. Ryan Pedrez. Dr. Pedrez is a pediatrician and clinical associate professor at Stanford University School of Medicine. He is also the medical director of the primary school, a new integrated health and education model that serves low-income students and their families in East Palo Alto. While at the primary school, he continues to care for his patients and teach pediatric residents and medical students at the Gardner Packard Children's Health Center and Lucile Packard Children's Hospital. Ryan also serves on the National Executive Committee for the American Academy of Pediatrics Council on School Health. He earned his MD at the University of California, San Francisco, where he completed his pediatrics residency and participated in the pediatric leadership for the underserved program. And last but certainly not least, we have with us Dr. Hayden Schwenk, MD, MPH, who is a clinical associate professor of pediatrics in the Division of Pediatric Infectious Diseases at the Stanford University School of Medicine. He is the co-clinical chief of the division and chairs the Lucile Packard Children's Hospital Stanford Pharmacy and Therapeutics and Integrated Infectious Disease Program committees. As medical director of the hospital's antimicrobial stewardship program, he is responsible for identifying and implementing strategies that improve antimicrobial utilization across the continuum of pediatric care. He received a master's degree in public health from the Harvard T.H. Chan School of Public Health and a medical degree from the University of Texas Southwestern Medical Center. Please join me in a really warm welcome for our panelists. All right, I think that, let's see. Let's start with an easy question, everybody. And again, we welcome each of you, physicians and Nancy McGee, to answer these questions, tag onto one another. This is really intended to be a conversation, so let's get started. Here's a question that many parents are asking. Given the many childhood vaccines already administered to our children, how do I know that the COVID vaccine won't interact with other vaccines to cause a drug-to-drug reaction?
I'm happy to start that question. Again, thanks for the opportunity to join you this evening. Really common and a really important question. I think people may recall that early on when the COVID vaccines first rolled out, there was an initial recommendation to not administer the COVID vaccine with other vaccines at the same time. So initially the CDC had recommended waiting 14 days before or after the COVID vaccine in terms of giving another vaccination. I think this was just based really on a lack of experience with using the vaccine in combination with other vaccines. And kind of two things became true really quickly. The first is that we had a lot of great safety data that suggested that the COVID vaccine was incredibly safe and was very similar to other vaccines in terms of its safety profile. We know that other vaccines, the majority of other vaccines can be administered safely at the same time. So there was really no good reason to think that the COVID vaccine would be any different with regard to that. But I think really importantly, we also recognized that we were seeing declines in the rates of vaccination with other childhood vaccines. So it became a real priority, making sure that our children were fully vaccinated with all of the routine child immunizations. And we didn't want there to be any kinds of barriers related to administration of a COVID vaccine at the same time as, say, the flu vaccine. And even before this was a vaccine that was available to younger kids in that 5 to 11 age group, it became really clear that that needed to be a huge priority, making sure that our population remained well vaccinated. And to facilitate that, and given that there was really a lot of compelling data to suggest it was entirely safe, that recommendation was changed. And really, we haven't seen any signals since changing that recommendation and allowing the COVID vaccine to be administered with other vaccines that would suggest that there's any safety issues related to that.
Okay, thank you so much, Dr. Schwenk. Anybody, that seemed like a very complete answer. Anybody have anything to add? Okay. So we already have really good questions coming in, and we thank you to the many of you who submitted questions in advance. This is one that we are hearing a lot. How can we feel safe that there won't be some long-term effects or side effects some years down the road for our kids from these vaccines?
I'm happy to start with that one as well, and then welcome the other co-panelists to chime in. I think generally speaking, when you look at vaccines that are being used in children and adults, the overwhelming majority of any kind of adverse effects are apparent within about 6 weeks of getting the vaccine. It would be very uncommon for there to be more long-term consequences related to vaccinations. Really not something that's been described with any of the vaccines that are currently in use. And it's for that reason that many of the trials were specifically designed to follow patients who got the COVID vaccine for at least 2 months afterwards, to make sure that in that window of time, they weren't seeing any adverse events that were unanticipated. We may get to this later on in the course of the conversation. What are some things that we would totally expect after getting a vaccination, including the COVID vaccine, like some mild fevers or some sore arms, something like that. But when we're thinking about serious adverse events, typically they are apparent relatively soon after giving a vaccination. This is a vaccine that has been now in use for a very long period of time, obviously in largely adult populations. And there are robust mechanisms in place by the CDC, the FDA, and the manufacturers themselves to identify any safety signals. Again, something we may get to later on this evening in terms of things that have been described with the vaccines. But really, we wouldn't anticipate there to be any long-term consequences with this vaccine, because the science behind vaccinations really would suggest that that's uncommon, if not essentially unheard of. And certainly would have been something we would have picked up by now.
Okay, thank you for that, Dr. Schwenk. So I think we're going to go back just a little bit. Here's a good question on the development of the vaccine, which I think is also something that many parents have questions about. Jennifer asks, what was the process for clinical trials for the children's COVID vaccine? How long were the trials and what were the results?
So I can start with this one. So in general, just going back to just development of vaccines and the duration of time it takes to develop vaccines. So in general, in the history of vaccines, it has typically taken a long time for a vaccine to go from what is called preclinical trials to actually getting into the arms of people. That is sometimes on the order of several years. The fastest vaccine we had before this was like for mumps, which was after 4 years. So usually it takes a long time. But with COVID, what happened is all those initials, the preclinical trials, which essentially means doing animal studies, had happened several years ago. So people were thinking about mRNA vaccines a long time ago. So all of those studies were already done. And then the other stages, the phases of trials that happen, which essentially involves a small group of volunteers that then progresses to a larger group of volunteers, and then a large scale trial, which is thousands of people. That whole sequence of events happened almost in parallel by multiple people involved in these efforts. And that's why those steps were way faster than it would have happened in previous years with other vaccinations. And so none of the steps that are involved in vaccine approvals were skipped to get the vaccines approved this time. So that's one point that hopefully we have all heard now months ago when it was first approved. For children, so once millions of adults have already now received vaccinations, and then the 12 to 17-year-olds underwent further studies to make sure that it is safe in that age group, and then the vaccines were rolled out to that population. In the meantime, there were trials undergoing for the 5 to 11-year-olds. So these are all happening as the world saw the vaccines being rolled out to different populations. There are the people in Pfizer and Moderna and all of them are working hard to advance the age further down. And so as we are speaking now, the 6-month to 2-year-olds are also, so it's continually happening. So the trials that had several thousands of children in the 5 to 11 years of age, and they basically approved using the information they got out of that trial, which essentially showed that it was safe and effective. It was mostly for safety that they did that trial, because we already knew that it was quite effective in the adults. So from a safety perspective, it showed that these children did fine. And it actually also showed that they had less infections in the arm that received the Pfizer vaccine as opposed to the placebo, which is like salt water. So that's exactly what happened with the most recent trial and approval.
Okay, thank you so much for that, Dr. Matthew. Dr. Pedrez, what are the odds that a child will have any type of problem, a reaction or side effect due to the vaccine?
Well, I think we can, well, first of all, thanks for including me here. It's really nice to be here, and so thankful to have my colleagues from Pediatric Infectious Disease. But I think we can look at the trial data that was just published on our 5 to 11-year-olds, and which as a guide to that, which is showing, one, that there was no serious lung adverse events that were reported and that were followed. And it was around 3% had really minor reactions, which include, a sore arm, fever, chills, some of the common reactions that the adults have found, but more minor symptoms. And so smaller number had side effects that were in the very minor category.
So is that 3% low or typical for a childhood vaccine?
I found that to be lower than what I was expecting. I don't know if Rosny or Dr. Swank want to comment on their perceptions of whether that was low or high, but it felt lower to me than normal, and but to be about expected.
I think I would agree with that. I think the incidence of those kinds of side effects is pretty much on par with what we would expect with most childhood vaccines, certainly not above what we would have expected. And in fact, if you look at the data, and I apologize, I'm also trying to answer questions in the Q&A, so I might have missed this. But if you look at the data, the incidence of some of these side effects was actually lower in children 5 to 11 versus some of the older age groups. So it may be even less likely to be an issue in that particular age group.
Okay, thank you, Dr. Schwank. Here's a related question I think is a good one. What can parents do to help build up their kids' immune system to help reduce the chance of side effects from the vaccine? Is there anything that parents can do to build up an immune system? Anybody?
Well, I actually look at it the other way, in the sense of sometimes when you see some of those minor side effects of a sore arm, or even a low-grade fever afterwards, that's actually a sign that your immune system's working really well, and the vaccine's doing exactly its job. And so when families ask me this question, I tend to flip it the other way, and saying that actually when you do see some side effects, shows that your child has a healthy immune system and is responding appropriately. And so I don't think there's anything in particular that I've read or seen to help that vaccine work even in better, except for common sense things of good nutrition, good sleep, and that I know all parents are thinking about.
Okay, thank you, Dr. Pedrez. Certainly we have had a lot of questions around safety. I'm sure that as physicians, this is what you're hearing from your patients and their families as well. Just quickly, a parent is asking, maybe this is a clarification item. What's the difference between children's vaccine and kids vaccine? I'm not sure if they're talking about the age difference or just whether the name is different.
Yeah, I'm not sure I understand the question entirely, but I'll try to answer it, and then maybe they can send a follow-up in
Maria,
the
if you
Q&A
want
if this
to
doesn't
send a follow-up
address
question,
it.
we'll try. Yeah,
Yeah,
go ahead,
absolutely. I think it's I think maybe the confusion stems from the dose of the vaccine. So it is true that the vaccine that's used for children who are 5 to 11 years of age is a third of the dose that's used for older children and adults. So there's only one vaccine that's been authorized for use in children 5 to 11 years of age. That's the Pfizer vaccine. But it is a different formulation of the Pfizer vaccine than what is used in older children and adults. It's a third of the dose, so 10 micrograms instead of 30 micrograms, has a slightly different buffer in it, which is basically just there to help keep the vaccine stable, is otherwise the same, but a smaller dose essentially of the vaccine. There's not a children's versus kids vaccine in terms of the name itself. I think that's just related to the formulation.
All right, here's a question I think, Superintendent McGee, we're going to let you have a crack at. David asks, since the schools opened in late August, the new COVID cases in California have been dropping and are now more than 50% down. Doesn't it indicate the probability that a child contracting COVID or transmitting it to another child is insignificant?
Yeah, I was actually busy trying to type an answer out, so it's faster just to say that out loud. There's actually lots of people who work in schools and lots of people in schools every day. So when transmission happens in a school, any adult in that environment, I mean, if anybody has any kind of underlying health complication, and last year, we actually had kids in school and adults in school without vaccinations. So we had more concerns, but now we have many of our staff members are vaccinated. But the reason why you see schools being safer is because we're all practicing very strict COVID safe protocols. Everybody's masking indoors. People are eating outside. There is a very strong effort to stay distant as much as possible. People are, classes have seating charts, so we're able to do contact tracing very carefully. So we know that without vaccinations, those, what we used to call the 4 pillars, those 4 pillars of safety really help reduce transmission in places like schools. So where we see transmission happening now with the Delta variant is that even though many of our adults did get vaccinated in our school settings, some people who are vaccinated still are ending up infected, although with mild symptoms. So for the most part, our schools are highly vaccinated in the adult population, most over 90%. In our high schools, in our like 12 to 17-year-old population, we are approaching 80% vaccinated. And after only 1 week of offering vaccinations to the 5 to 11-year-olds in San Mateo County, we're almost at 20% vaccinated. So those vaccinations help mitigate the symptoms and the seriousness of the disease. And I've in talking with county health just this morning, we're recognizing that the real question is around vaccinations, not whether to get vaccinated or not. It's sort of understanding that if you're not vaccinated, you're much more at risk of severe illness and hospitalization and even death. If you're vaccinated, those symptoms, you can still get COVID, but your symptoms are much milder, like a cold or the flu. So we're able to go to school every day and, like I said, safely learn. But there's a lot of focus on safety protocols. We're nowhere near letting down our guard on those.
So we're not going to see kids without masks anytime really soon, do you think, Superintendent McGee?
You know, right now we're actually heading into the winter surge. So the last 2 weeks we've seen cases in schools rise. We're starting to see more multiple cases inside a classroom as more, you know, the weather gets colder, kids are staying inside more. So now would not be the time to lighten up on any kind of mask guidance. We really want to protect the educational system. And actually our children have really adapted and our adults have really adapted to the mask wearing, and it's keeping everybody relatively safe from transmission of spread. So I think for most of this school year, we're likely to be masking in schools.
All right, thank you for that, Nancy. Here's a question that came in from one of our Spanish speaking attendees. Thank you, Maria. She asks, what are the rates of mortality in children if they are not vaccinated? Anybody?
So I think, I don't know how to answer that exactly because, but we know that about 600 kids, so less than 18 years of age, have died from COVID-19 since the start of the pandemic. And that is for pediatric deaths, that would be considered a high number. So that would be the number of deaths in pediatrics from COVID specifically.
Okay, thank you, Dr. Matthew. Here is an interesting question about allergies in children. Mary asks, I have a question about my son who is allergic to penicillin. Can he get vaccinated for COVID?
My answer is yes. Oh, go ahead. Go ahead.
No, I think my answer is exactly the same. There's actually very few contraindications or reasons to not get the COVID vaccine, but an allergy to penicillin would not be a reason to not get the vaccine.
Okay, fair enough. Here's a good one. I am vaccinated, but my partner is not. If our children get vaccinated, will they be protected from my unvaccinated partner or other family members?
So essentially, the way I would respond to that is vaccination is a very good mechanism of protection along with several other strategies, but it's a strong part of that whole armamentarium. However, what we know is that what vaccination does best is it protects against severe disease and death. We do know that we are seeing infections occur in vaccinated individuals. So the other thing in this context I would like to mention is that with household exposures, there is a high risk of transmission. So COVID being a respiratory virus, prolonged duration of close contact is how you acquire the infection. And so household environment is one of those very conducive environments for transmission. So when a person is unvaccinated due to whatever reason, if they, for example, are very cautious with the other things that they do in public, for example, they're very cautious with mask wearing and they are not doing any kind of risk activities that would enable them to get infected, then they would be protected and thus protect the rest of the household as well. So it really depends on a lot more than just, just being a few, but vaccination is definitely helpful. It's not 100%.
Okay, thank you for that. Back to the approval again for a minute, if we could. What is the difference between approval for emergency use versus regular approval for a vaccine? Is it better to wait until the vaccine is out of emergency use approval and has had regular approval in this case for kids?
So I invite Dr. Matthew to comment on this as well. This is a pretty common question. I think it's important to distinguish, what does it mean for something to be authorized versus for a medication or a vaccine to be approved. So currently there's only one COVID vaccine that's fully approved by the FDA. That's the Pfizer vaccine for use in patients 16 years of age and older. So that does mean that the rest of, the Moderna vaccine, the use of the Pfizer vaccine in people under 16, the J&J or Janssen vaccine, those are all authorized under what's called an emergency use authorization from the FDA. Truth be told, it's very similar to a full approval with some slight differences. The major difference just being the amount of data that has to be submitted to the FDA to receive a full approval. It does not mean that there were any shortcuts. There were still phase 1, phase 2, and phase 3 trials that were done for all of these vaccines. As Dr. Matthew mentioned, many of these were done in parallel, many of these steps, because essentially we were facing an unprecedented crisis. So there was an urgent need to get vaccinations to people and in people's arms as soon as possible. An emergency use authorization basically allows for that to happen. It does mandate that there be a sufficient amount of data to support the efficacy of the vaccine, to support the safety of the vaccine. There still needs to be several months of safety data in the clinical trials to prove that the vaccine does not cause and is not associated with any appreciable adverse events. There are safety mechanisms that have to be in place for monitoring these vaccines once they are authorized, surveillance mechanisms to make sure that if there were any serious safety signals, those are picked up and can be responded to. But the amount of data that has to be submitted to the Food and Drug Administration, the FDA, is just less, essentially. It takes many, many more months of data before that full approval can happen. As a reminder for everyone, because I think this is something that's, sort of important to keep in mind, although things are moving really quickly, that first emergency use authorization for a COVID vaccine was nearly a year ago now. It was in December of 2020. So we have almost a full year's worth of data and experience with the Pfizer vaccine. And again, have not really picked up any serious safety signals that have changed anything. And that was what allowed Pfizer to go ahead and submit for that full approval for people 16 and over. So hopefully that answers the question. And I don't know, Dr. Matthew, do you have anything else to add?
Not really. So just between the approval of the Pfizer and the full licensure of the vaccine, nothing really. They did not amend or change anything. So that's how it was licensed eventually. So it's a lot of review work and completing certain review of the manufacturing plant, and so many other things goes into full licensure, but the actual vaccine itself received full licensure without any further edits.
And Dr. Matthew, could you clarify, you mentioned earlier that although the COVID-19 vaccine is relatively new, we've been working on mRNA vaccines for close to a decade. Is that right?
Yes.
Okay, I think that may help parents who are worried that this is a very new vaccine that's untested.
Right, it is new in the sense that this is the first vaccine that's approved, mRNA vaccine that is approved for use in like human population. So there was lots of work on mRNA vaccine prior to use as a in this manner in the public, but it's undergone lots of scientific studies for over a decade now.
Thank you. That's really important information. Here's another question that's come in Spanish. Thank you so much. Good question. I have read, she says, that vaccines can create clusters even in adults. What about this risk in children? Clusters.
Does that mean maybe clots?
I think that's possible, Nancy. Let's go with that. Let's see. Pueden crear coágulos. Yes, that would be clots.
So
I think they are referring specifically to the J&J vaccine, which was associated with this very rare side effect of development of clot, particularly in women. That similar finding has not been seen with the mRNA vaccines. We are not very worried about that particular side effect with this vaccine.
Okay, thank you. Good question. Good answer. Here's a question that we get a lot, and I know the answer can be complicated. Many parents ask, we've heard that the COVID vaccines may affect our children's future fertility. Could you comment on that?
So I think this is a very common question that we get from people in the community, and I think it's an important one to try to address. So, I think some history and some background about this question is important just for context. This was a concern that was raised a while back on the basis that the vaccine could basically, result in the production of an antibody that would attack a protein that's in the placenta, and that looks similar to the spike protein, essentially, of the coronavirus. But essentially, there's no plausible reason, there's no medical or scientific mechanism that would suggest this vaccine will interact with a woman or a man's reproductive organs in any way. And in fact, one of the things I like to share with patients and families is that there were a number of women volunteers during the Pfizer vaccine trials that actually became pregnant during the trial. There was only one woman who actually suffered a pregnancy loss, and that was a woman who actually had received the placebo and not the vaccine itself. So I think an important piece of information to keep in context. I think the other thing that's really important to remember is, although we don't have any data that COVID-19 vaccine should impact fertility, there's very, very good data about the impact of COVID-19 disease on the health of pregnant women. And so this is a vaccine that is highly recommended for women of childbearing age, for women who are pregnant, because we do know that women who are pregnant are at risk for more severe COVID-19 infection. But essentially, there's not really any data to suggest that we should have any particular concerns related to the COVID-19 vaccine and the impact on fertility. There have been other studies that have been done. There was one that was done by the American Society for Reproductive Medicine, basically, that looked at the success rates for pregnancy among women who were presenting for in vitro fertilization. And the presence of antibodies, either from the vaccine or from the infection, really had no impact on the likelihood of success of fertility. And there's also data looking at sperm characteristics, semen analyses, and other things to address male fertility. And there's been no link between male fertility and the COVID vaccine. So really just an abundance of evidence that would suggest that there's not really a particular link between issues related to the vaccine and fertility, but certainly lots of really good data to suggest that for women who are planning to become pregnant or who are pregnant, the vaccine can be very important for mitigating risks against the disease itself.
Okay, thank you for that, Dr. Schwenk. This is a question that came in previously from one of our audience members. Are there any issues with the COVID vaccine for children with cognitive disabilities or a history of seizures?
Those are not contraindications for receipt of vaccine. There's nothing specific about the vaccine that makes those conditions an issue.
All right, so you would be comfortable with children with those conditions getting vaccinated, is that right?
Yes.
Okay, that's,
I would actually add that not only would I be comfortable, but I'd strongly encourage vaccination of those populations because they may be at particular risk for more severe COVID infection and complications. And so all the more reason to make sure that they're being vaccinated.
okay, good point. Thank you, Dr. Schwank. Nancy, did you have anything to add to that
I
one?
was just going to add that very point because we, in our programs, work with students with severe disabilities, and our families are very cautious and proactive about their children's health. So the vaccinations are very important for those particular children.
All right, here's a related question, and I think it's a fair one. A parent asks, when should a parent consider not having their child vaccinated? Now or once we are beyond emergency approval? Are there any conditions in which you would not encourage vaccination?
I can't think of any unless there was an absolute contraindication to getting the vaccine. So if you've had a severe allergic reaction to the first dose, let's say, of the COVID vaccine, an anaphylaxis or an immediate allergic reaction, then you shouldn't receive a second dose of the Pfizer vaccine if that was the vaccine you had an initial reaction to. Or if you're allergic to a component of the vaccine. Outside of that, I can't think of any specific conditions where I would counsel against getting the COVID vaccine.
Okay, thank you. All right, before we start taking questions from the audience here in a couple of minutes, here's one that I think is important. Does our immigration status affect whether we can get our kids vaccinated? And are the vaccines free?
I know from my point of view that we're vaccinating all children and there is no cost to families. Those families that have private insurance, that insurance information is collected when they register for their vaccination. And then in San Mateo County, all children are covered on the Children's Health Plan. So there is no cost for the vaccination to families.
Nancy, will there be COVID vaccines available through the schools, or are you currently doing that?
There's a mixture of opportunities. So the first place we'd like families to go is to their pediatricians for their vaccination so that they can get their well child visits and catch up on any other healthcare needs. The pharmacies in San Mateo County are taking appointments. And we are doing some school-based events. We have 4 events, in fact, this week, 1 each day this week in different parts of the county. And each event is fully booked with about 700 appointments for each day. And then San Mateo County Health is holding the large-scale events at the event center. And I believe on some Saturdays, they've vaccinated up to maybe 12 or 1,300 young people, 5 to 11.
Okay, and you'll see also in the chat, my partner Bev just posted the San Mateo County Health Clinic link in both English and Spanish, so please do check that out. That is a great resource. That's a lot of people, Nancy, a lot of kids.
Yeah, we have about 70,000 5 to 11-year-olds, so we're chipping away.
Giving away, that's awesome. All right, last question before we really move into questions from you all, the audience. Do you think kids will need a booster shot in the future, or will this current 2-shot regimen be it for now? Anybody?
I think it's hard to know what is to come down the pike, but one of the reason why we have boosters in adults is because we know that the immunity wanes over time. So the expectation is that COVID is not going to go away and that we would need vaccinations in some form on a regular basis. For example, right now we have influenza vaccines that happen on a yearly basis. So the expectation is that we would need COVID vaccines in the future. But for now, I think that's that's a question that we would only know the answer for in the next several months.
All right, thank you so much, Dr. Oh, I'm sorry, go ahead.
The only thing I'll just add to that is what we do know is that the vaccine immunity is longer and more protective than natural immunity from kids that have received COVID if they were unlucky to catch the virus and recover. We do know that there's stronger and stronger evidence that vaccine-induced immunity is longer lasting. So I saw that question come up a couple times in the chat. If they've had COVID before, do they need to get the vaccine? The answer is yes, we highly recommend it.
And Dr. Pedrez, that advice holds true for adults or children. Is that true?
That's correct, yes.
Okay, so even if you've had COVID, you should still get the vaccine. Okay, my pregnant daughter-in-law got it, so we're very hopeful. All right, here's a question where I'm glad we have a room full of experts in infectious diseases. This parent asks, we've had coughs, colds, croup, stomach bugs in our children's school this month. We even had our kids tested when symptomatic. Tests were always negative. With safety protocols in place, why are kids still catching things but not COVID? Basically, lots of colds, but no COVID.
I'll take this because I was about to answer that and starting to type up my answer. I just think that viruses are very clever and they find ways to evade and find the non-immune host. And we know that children typically get viral infections when they're young. And so these viruses are hanging out somewhere. For example, RSV is a common childhood infection. The full name is respiratory syncytial virus. It's an extremely common infection in infancy and young children. And last year we did not see any RSV and we were wondering where it went and whether it completely disappeared. And then it kind of came back with a vengeance. So viruses hide and they find a way to infect anybody who is not immune. I think the masks and hand washing go a long way, and we have seen in the hospitals that we work, we can tell you that we have seen substantial reductions in all sorts of viral infections because everyone's masked and everyone's doing everything now to prevent. But at the same time, none of this is 100%. So we are going to get one or the other virus. If it is not respiratory, it is through the GI tract, so the gastrointestinal tract. So in some way, we are going to get the infection. But it's a great question. I think we don't have a great answer, but at the same time, this is what viruses do.
All right, thank you for that, Dr. Matthew. For those of you who joined more recently, doctors, if you don't mind just summarizing, where should people go to find information on the side effects of the vaccines? And just reassure us again that these vaccines for kids 5 to 11 are safe. That seems to be the main question tonight.
I was just going to say that the credible information is obtained, like, in preparation for this seminar, webinar, for example, we went to CDC's website and we went to American Academy of Pediatrics just to make sure we have all the right information. And just, we all have kids as well. For me, it's a no-brainer. I have kids in the 5 to 11-year-old age group. For me, it is a vaccine preventable illness. Just like vaccinating against all other infections, to me, it's a pretty straightforward decision. So just wanted to share my personal experience in case that helps.
Thank you, Matthew. Dr. Matthew, that's great to hear. We are seeing in Europe that they're experiencing a new surge of COVID cases. Do we think that bringing vaccines down for this age range will help prevent the US from seeing a surge?
So I think that the reasons for the surge in Europe are probably multifactorial and complicated, and it's not just vaccination or lack of vaccination of 5 to 11-year-old children. So I certainly wouldn't hang my hat on that protecting us from experiencing a similar surge here in the United States or more locally in the Bay Area. I think there's a number of factors that probably have contributed to the surge that is being experienced in Europe, including just lower rates of vaccination more generally than what we see here in the Bay Area. And it remains largely a disease of unvaccinated individuals, even in Europe, where they're experiencing this surge. Similarly, I think like many of us, I mean, we're all tired, right? I mean, this has been a very long couple of years for all of us. And I think there's a general sense of fatigue with a lot of the measures that we know can help protect us from COVID, like social distancing, like masking. So I think people have let down their guard a little bit. And we have particularly the countries in Northern Europe where the weather has turned a bit colder, we're moving indoors, we're disregarding some of that social distancing and mask wearing that we know can help keep us safe. And that has probably also contributed to the increase in the rate of COVID that they're seeing there. Certainly anything we can do though to vaccinate our population though, I think helps to mitigate against that risk. But I don't think that alone is going to protect us. And I think the sort of I stopped making predictions long ago about anything related to COVID and trajectories and in terms of what's going to happen. So hard to say, but certainly think it's one important step in trying to protect us from something like that. And I apologize, Dr. Pedrez. I think maybe you were going to say something too.
I was just going to respond to the prompt of kind of, summary of where we are in terms of safety and efficacy and I agree with Dr. Matthew. I have 3 kids in the 5 to 11 range, was first in line to get all 3 of my kids vaccinated. I think looking at the safety data is very convincing, but most importantly, the efficacy data in my mind, in the sense of my choice to prevent my children from getting hospitalized or serious infection from COVID-19, I didn't want to take that risk. This is a vaccine preventable disease now, and it was a no-brainer for my family as well.
I think that's a really important phrase, Dr. Pedrez, vaccine preventable disease. Would you expand on that for just a minute?
Yeah, and I want to clarify that it's not vaccine preventable because you can still catch the virus with the vaccine. But what we know this vaccine is able to do is prevent serious consequences, hospitalizations, and more serious disease. And so it becomes a much more common cold-like symptom than rather, very rare, but still happens, of the multi-system inflammatory, MISC, or just frankly having to go to the ICU or hospital. I wouldn't want any child does not need to have that happen.
Thank you for that. That's a really important clarification. We have some parents on with young children. Do any of you have a sense of when the vaccine will be available for kids under 5?
I don't have any special knowledge of when that will happen. I know that it is an area of active research. So there are multiple studies that are ongoing right now looking at vaccinating children under 5 with the goal of actually being able to vaccinate children 6 months of age and older. But obviously, like everything else related to COVID vaccine, this is being done, in sort of as safely as possible, making sure that we have all of the data that we need before making any recommendations related to that. So I'm actually not sure about the timeline. As the parent of a 2-year-old, I am eagerly awaiting the ability to vaccinate that child. I have a 6-year-old who's already received his first dose of the COVID vaccine. But looking to get all of us vaccinated as soon as possible. But I can just say that I think we're all eagerly awaiting that.
What about some of the things that we read in terms of long-term COVID? Is that a risk for children as well?
So that would be not related to the vaccine. It would be related to getting infected with COVID. So the long COVID, it has many different names, and that is more commonly described in adults, but we do know children also experience it. The information on children is much less robust, but we know that it happens. So talking about COVID, so I think this is also good information that COVID infection can many a time be quite mild in children, which has thankfully been the case. But then there are these other entities like the long COVID, for example. We do not know who might end up getting long COVID. The other complication of COVID has been something called multi-system inflammatory syndrome in children, or MISC. And it's a pretty dramatic, severe complication that again is very rare. And again, a patient that may have no other previous health conditions. So we've seen a lot of MISC kids that have been previously completely healthy, never been to a hospital before, who basically end up in the ICU. So that happens, and again, uncommon but unpredictable. So those are some of the manifestations of COVID that working in the hospital as an infectious disease doctor, we do see those things happen, which obviously are rare, but we have seen.
All right, so as we have just a few minutes together left, I would like to ask each of you doctors, you're all parents. Could you take off your physician hat for just a second and put on your parent hat? What would most convince you about the safety of these vaccines? What would you tell your friends who really are hesitant?
Can go first. I think when it first came out, when COVID vaccinations first came out, I was a little worried about giving it to my children. This is, last year in December when we were standing in line for the COVID vaccines as healthcare workers. And at that moment in time, we didn't know much about what's going to happen. And then after now, like millions and millions of people have already received the vaccine. So I don't need a trial to tell me something. I have real world experience that has shown that the vaccine is safe and effective. I think that is what is convincing me now that we have a lot of information. We have seen actually certain side effects that were a bit of a surprise, but we have seen through all of that. We have been through all of that, and they have taken measures to make sure they get the dose right, for example, for the next age group. And so I feel very confident and so have no hesitancy at the moment to vaccinate.
Thank you for that, Dr. Matthew. How about you, Dr. Padres?
Yes, similar to what Dr. Matthew shared, what makes COVID, I think, most scary in my mind is that it's very unpredictable. I cannot predict which children are going to get severely ill or which children are going to get hospitalized or that rare complication at MISC. It seems to follow no pattern of whether someone had multiple conditions before or not. And so with that unpredictability it's what, in my mind, is really convincing that we do know from the vaccine it can be very effective at preventing those serious complications. And so, but I agree that I want to acknowledge it's completely normal to have some questions or concerns or to be wary of getting this vaccine. And that's normal. This is within a relatively fast timeline of 2 years that this disease has been in our vocabulary. And so, but with so many doses now administered of the Pfizer vaccine across the world, basically, and the safety data that's being I in my medical career, which I know is not that long, I've never seen so much safety data being tracked on a certain vaccine. It's rigorous and it's well done. And so in my mind, it really convinced me that the benefits far outweigh the risks of what the vaccine might be there.
Thank you, Dr. Padres. Nancy, I know you and I have adult children. You have one young grandbaby, but you've got tens of thousands of our kids. What do you say?
Well, I'm just so grateful. I'm grateful to the doctors, the researchers, the scientists, because when we all went home to distance learning in March of 2020, I couldn't have imagined that we were dealing with an unknown disease and that we would already have access to an effective vaccine within 18 months. That to me is what education is all about. It makes the world better, extends our lives, improves our opportunities, and it has done so for school kids. I mean, we're across the country because of vaccinations of our workforce. Last spring, we are back in school in person. So I'm just really grateful. That's my message.
Thank you, Nancy. That's a great one. Dr. Schwenk, how about you for some last words?
I think I would just echo a lot of what's already been said. I think to just make this a little more personal for me and kind of what weighed on my mind, I think similar to Dr. Matthew, I go into everything with a little bit of skepticism, and I wanted to make sure that this was a vaccine that I thought was safe before it was something I was going to administer to my own child. I think, as Dr. Pedros has mentioned, there's a vast amount of data that's been collected so far. We have a vaccine that's been available for nearly a year. We have robust mechanisms in place to detect serious safety signals, and I'm very reassured by that data. The data is sort of what leads me, and everything that I've seen has been very compelling and very reassuring. So I think that's one thing that sort of weighs on my mind. I think the second is that I acknowledge that the likelihood that my child, my 6-year-old, would get very sick from COVID is probably not very high, although it is entirely unpredictable, as has already been mentioned. But my child can still get COVID and can still infect other members of my team, of my family, who are vulnerable, who, if they did have COVID, it could be very, very severe, including their grandparents and other family members. I want my kids to be able to spend time around those family members. I want that to be as safe as possible. And being able to resume some sense of normalcy as soon as possible was a huge priority for me. And another, big driver for something that's safe, as the COVID vaccine has been shown to be so far. It was sort of a no-brainer for me that this made sense for me and my family.
Thank you so much, everyone. Dr. Schwenk and Dr. Matthew, Dr. Pedres, and Superintendent McGee, you have all been wonderful. We have many people saying thank you for all the great information. Just quickly, before I hand it back to Lawrence Capel, Board Chair, I would like to ask if you can, there was a link in the chat with a very, very short survey. We would love your input. We promise we read everyone. Again, thank you everyone for joining us tonight. This event will be recorded and available soon on our video library. Thank you, everybody. And back to you, Lawrence.
Thank you so much, Charlene. I sat here really enthralled throughout this particular presentation. I really want to thank our panelists. A lot of the information that's been floating around always has that question mark at the end of it. And we need to listen to the experts in the field, and you are the experts in the field. What I learned quickly, and I have a little bit of personal side of this. I have an 8-year-old grandson who has had COVID twice. And the only thing he talks about is his classmate who passed away from COVID last year. And so little kids do get COVID and they do die. I was talking to my daughter before this thing went on, and he's taking his shot tomorrow, first in line, hopefully first in line. But you can get sick, and you can get seriously sick, and you can die. 600 little kids who passed away through this pandemic. I don't want to take that risk with any child at this point. And so what I learned tonight was that we have done a lot of work on this. A lot of people thought that this vaccine was developed overnight. Many years went into the development of this vaccine. It's been tested probably as much as any other vaccine on the marketplace. It has a lower rate of side effects than most of our common programs, vaccination programs. This is a good vaccine, and it's also a critical component of eliminating the pandemic in this country and hopefully many other countries. So I do want to encourage people to listen to the data that you listened to tonight, listen to the opinions and the scientific fact, and do the right thing. And so I encourage everyone to get a vaccination for their young child. Thank you again, everybody. This was wonderful, and we'll be doing more of these, and hopefully we'll be able to present a number of different sides to all these arguments. Thank you so much.
Thank you, Dr. Capel. Stay safe, stay well, everybody. Take care, and we hope to see you again soon. Good night.